Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Right. Solitary thyroid nodule is a palpable, discrete nodule of the thyroid. So, what is most common solitary thyroid nodule? Most commonly, solitary thyroid nodule is benign colloidal nodule is the most common solitary thyroid nodule. This benign colloidal nodule will account for almost 60% of cases of solitary thyroid nodule. Then what is the second most common solitary thyroid nodule? Second most common solitary thyroid nodule is actually follicular adenoma, and this follicular adenoma will account for around 30% of solitary thyroid nodule. Then, what about the risk factors? What are the risk factors for solitary thyroid nodule? The main risk factors for solitary thyroid nodule are history of ionizing radiation is an important risk factor. If the patient is exposed to any ionizing radiation, it is one of the important uh, cancer ionizing radiation, because ionizing radiation will predispose a person to thyroid cancer. If the patient has family history of thyroid and other malignancies, then it is an increased risk factor. If the patient has a thyroid cancer also, there is an increased risk factor. Then once you think that there is a solitary nodule of thyroid, then first you will have to palpate the patient behind the thyroid. From behind, you should stand behind the patient. So first you should stand behind the patient, and then you should palpate the thyroid nodule. And while you are palpating the thyroid nodule, the neck should be in mild extension position. Now, if the nodules are hard, gritty, and if they are fixed to surrounding structures, if the nodules are hard and gritty and if they are fixed to the surrounding structures like either trachea or strap muscles, then there is increased chances that these are malignant. Then, investigations of the thyroid nodule. In the investigation of the thyroid nodule, the initial investigation of solitary thyroid nodule is thyroid function tests, whereas the investigation of choice for the thyroid nodule is FNAC, is the investigation of choice for the thyroid nodule. So if there is a thyroid nodule and if you think or if you suspect that it is malignant, so in such cases, it is better to do a surgery, which is total thyroidectomy is done if you suspect that it is a malignant tumor.
thank you and thank you for watching.